you start getting poked and prodded in ways that had kind of been dormant, dissociated, pushed off, and that's when people they come because something's not working, and it's often in a relationship. And to address that, you have to address it in relationship. And if you're going to address it in relationship, I think what we're both pointing to is that shit's going to take time.
Welcome, Dr. Jayce Long. Thank you so much for being here. You are a psychoanalyst in training, technically speaking, but a psychoanalyst in my heart. You're certainly a psychoanalytic psychotherapist. And we're here today to talk about something nerdy and fun for people like us, especially in terms of the ontogenics of becoming an analyst. But we're going to make it accessible to the layperson. So with that all said, if you can provide us what motivated you to be here today, what you wish to talk about, that you feel most passionate about in relation to implicit learning or the didactics as we spoke to, or what's contrived versus what's a genuine organic development in both this process for the practitioner and patient.
Sure. Well, as you said, I'm in psychoanalytic training and went to a psychoanalytic graduate school.
Very cool.
I don't fully realize what I was getting myself into when I got myself into it. But I think I start with that because I've had the pleasure and the benefit and the pain of going through quite a long journey of in my own becoming process, and to really appreciate that. And I think along the way, there's been a lot of teaching, a lot of techniques, a lot of information that it's been made explicit. But I think today maybe we can talk about that process of becoming, what it means for psychotherapy training, and then what it means for psychotherapy as well, and how we deliver it, how we listen, what we're looking for, and what we're maybe a fundamental question is what we're trying to help the patient become. I almost said do, but I want to emphasize that we're trying to help them maybe become more themselves, discover themselves, construct themselves.
Right, versus doing anything.
Yes, versus doing, I guess, that what we're prescribing is the healthy thing to do, which I think we see more and more of that. And I can't help but think of Winnicott in that we might be impinging, maybe like the patient's caregivers. So, and I think we run the risk of doing that more when we're not aware of our own stuff, and that we may get in the way of the patient's process of becoming because we're projecting and we're impinging all of our knowledge onto them.
Right. So among all the motivations of
Mm-hmm.
mine that I was bringing you here today and excited to have this discussion, the way you spoke to, I don't know if it's okay to tee you up right away. Of course, you can steer this in the direction you wish to, but the way you spoke to listening prior to our recording today, I thought was very neat and interesting. The way that you were connoting listening and all the layers of listening.
Mm-hmm.
And how the difference between listening, versus impinging, or being in
Mm-hmm.
it versus intervening, holding a space or a frame. I don't want to start putting words out there too soon.
Mm-hmm.
Versus prescribing, contriving is the enemy of discovery, or invention is the
Mm-hmm.
enemy of discovery. And so much of what you were describing about what's available implicitly or non-verbally and that form of listening, I think for our listeners, pun intended, would be very cool, as I haven't really had an opportunity to discuss that.
Mm. So, and I noticed myself trying not to do it, even as you were asking the question, is that I think it's a difficult sensibility to embody, of trying to listen without coming up with your answer, without listening without the waiting for the other person to end, rather than embodying a listening that is trying to invite the person out, to track where they're at, to as much as you can put yourself in their world, and then to bring it to this idea of how we listen, right? The implicit listening, that if we have an agenda, I think that's probably a term that gets, of how we think the session should go, how we think the treatment should go, that what I just spoke to earlier, that's going to intrude on the treatment. It's going to intrude on the patient. And whether it's a timeline, whether it's a goal that is more the therapist than the patient's, that listening, you're intruding your own agenda into the listening process. Is that making sense the way that I'm saying that?
Yeah, of course, sure.
Yeah.
It's the tension, the dialectic, as we spoke to, between impinging versus utmost, I don't know, freedom or loss. You know, there's always going to be this tension between holding on to the frame, being neutral, being the blank canvas, but not being, of course, cold, but you're not also intervening or impinging or directing or robbing the patient of their own opportunities for discovery. You're not collapsing the possibilities of reverie and so on. At the same time, that form of being and that form of listening is so challenging because we're so much more comfortable, especially when we're inexperienced, with the directive, the prescriptivist attitude, the intervention, the hedging against our own anxieties by doing something, solving the problem, colluding with the defense.
Right.
I could probably list 500 phrases that I've been inculcated with at this point in my own training, and they all kind of mean the same thing. But this art and science, to me, is so fascinating in this discussion, is that it is very difficult to talk about, ironically, because it's something that's felt and not exactly something that can be taught in a more top-down manner than it is experienced and bottom-up.
Totally. Well, yeah, I mean, I think you said it well there. And
well, it is my podcast. Yeah.
Yes, right. Well, you made me think that this, I think sometimes it can, well, maybe to me, I won't project onto everyone else, that it can feel like a psychoanalytic sensibility versus a more CBT or kind of didactic sensibility. But I think that's doing the psychoanalytic world a little bit too much service there.
Yeah, get spicy, please.
Well, the psychoanalytic world, right? If we get into our theories, we get into our own interpretations, and that one may try to fit a patient into a theory and miss out on the nuances of what the patient is bringing in. And I think and then what maybe I just posted another Marotta quote today, it maybe beat the patient over the head with their own interpretation that they're so convinced is correct. So I think this is an issue within the psychoanalytic world as well. But I think we see it more broadly, almost endorsed and encouraged in the more didactic forms of treatment. So so to listen, I guess we can get back to this, broadly speaking, the implicit forms of change. How I think there's some analogies of we're born dancing. We're born kind of in the rhythms of relating in our earliest relationships with our caregivers. And some of those dance moves, to play with the analogy, are pretty loud, and maybe they get evoked pretty strongly in new intimate relationships, whether it be a teacher, an intimate partner, a friend. And some of those things are very kind of nuanced and quiet, and they're small little maybe missteps or moves that we make. And I think a lot of those things in a psychotherapy relationship I think the louder ones hopefully get addressed quite reflectively and consciously. And then a lot of the other things I think get addressed more in an unconscious, inactive way, where there are new ways of relating through hopefully the analyst's cultivation and embodiment of their own authenticity, spontaneity, curiosity, that those things play out through the new relationship. You learn to dance a little bit differently.
I think it's a very useful metaphor. I haven't certainly heard choreography before. I've certainly, but not specifically in terms of the dance, Fleetwood Mac reference, or I might get copyrighted for that. That you're dancing with your primary caregivers, as our colleagues say all the time, that the relationship with ourselves is forged in the relationship to the primary caregiver so early on in life. And some of those dance moves, like you said, are bigger, larger, more impactful, maybe more deterministic, and others are smaller, more implicit, maybe more neutral, I don't know, maybe more benign, and more conducive to the development of the child. And then in the analytic sanctuary, the consulting room, is we're trying to mimic that, in essence. but in a way that's, of course, we don't have a dog in the fight by design, that there's a neutrality, and that provides the wiggle room to start maybe dancing again for the patient in ways they haven't felt safe to do so before, and most fundamentally, and of course then exposing them to what's behind a symptom or a personality trait, and see what's generative, what's giving rise to a thought, feeling, behavior, conviction, belief, what have you. And they've never been able to see it, right? Because if they all the more didactic, interventive, impinging types of work don't allow for that space, the choreography of the dance, so there's not a dance floor. And I like to, I can really tear a rug, I can bust a move with my patients. So, I mean, this is wonderful. I like this metaphor. This is great.
Yeah, well, it's interesting because I think, well, one, the metaphor is coming quite explicitly from, I've heard it used in some of the literature on the kind of the dance between the implicit and explicit forms of knowledge, communication, listening, and that there is a kind of back and forth dance. I think more personally, and I think this is why maybe I have a passion emphasis on the implicit, on the procedural, is I was an athlete before I was into psychology, really, before I went to graduate school. And so it always struck me that, you don't learn to play football, you don't learn to play basketball primarily from a basketball handbook, and just how much coaching, how relational coaching can be, and how much trial and error, how much getting out there and kind of playing, right? And I think this is where, a dance metaphor, because you're often, it can be choreographed, you're dancing with someone, but how much there can be freestyle, there can be creativity, and that how much that can be modeled. So how impactful one, say, dance coach or dance partner can be in cultivating your own freedom to move creatively. And so I think that's where, these metaphors, because what's often the one that I hear a lot is like learning to ride a bike, which is fine. That's a procedure, but it's with an inanimate object. And I think there's something here where like these procedures that maybe are more familiar that we can use metaphorically to get people to think, and maybe trainees to think of, like the dance, the play, the spontaneity, the creativity that is being interwoven in the treatment setting. I think that brings it to life a little bit more than here's this handbook, let me intervene. I think to me, it invites a bit more freedom and a bit more, playfulness to the process.
And that's what's so lost, is that, as I've discussed on other episodes here, is that it's such a challenge for somebody to tolerate playfulness, spontaneity, improvisation, the dance, all of it. I think you bring up a good point. I'm certainly guilty of using the bike metaphor because, as Marotta says, it's multimodal learning.
Mm-hmm. Mm-hmm.
And it's useful in that people think the stereotype's pretty ugly, that therapy or psychotherapy is an intellectual sport, when it's totally experiential.
Mm-hmm. Mm-hmm.
You can't change in the topography of the brain or the mind, however you want to parse it. You can't change through cognition or cogitation alone. It has to be experiential, it has to be bottom up, it has to be inclusive of, as you're using the phrase, embodied. It has to be experienced near fashion. And so the dance is good in that, maybe better, as you said, because the bike is inanimate and isn't providing feedback, although maybe you could argue it is, but the dance partner certainly alive with you, and you're generating that space, you're generating that possibility, you're generating the discovery. The hard part being not only to bring it back to teaching that, how do you teach that to the inexperienced therapist or the therapist who wants to learn, but how do you fuel that space? How do you service that space? How do you cultivate that space? How do you make that fertile soil between you and a patient who has not yet experienced something like that before? And they're so comfortable with the solution focus, the externalities, the tell me what to do, doc. And in my experience of training, supervising patient work, what have you, it's a shared anxiety. And that, having to have the capacity to, it's like learning improv or learning acting or learning a sport or learning dance, like we're saying, and it scares the shit out of people. Right, because it's so uncomfortable to be present and yet still be present in dedication or tact and craft for the other. and not yourself. It's such a unique subordination of your own, let's say, personhood, and yet you're still there, choreographing in essence, but not in such a way that it impinges, but in a way that's most conducive to the individual's or the patient's talents, to get them know themselves and resolve their own, inner turmoil or conflict.
Well, I mean, you make me think again, this point of emphasis that I think the psychoanalytic world explicitly has of hopefully cultivating, nourishing the growth of the analyst in training. What personal therapy, supervision, these are, and that those things are not just epistemological transfers of knowledge. That again, there's this, to get a little nerdy, there's some
How dare
Thomas
you?
Ogden's been, yeah, I know, right? Thomas Ogden's recent stuff, which I love because it's kind of psychology and talking about Beyond and Winnicott, but of ontological psychoanalysis. And I don't think he's drawing it too strong of a line between this transfer of knowledge, what he calls epistemological, that was more, he called it, I think, Freud and Klein, kind of the delivery of interpretations. If I can give this person this information, that can transform them, versus again what we both been speaking to of nourishing something, the process of becoming, that needs to happen from the top down. And so whether it's the psychoanalytic institute or the graduate school, the training program, that if you don't have some type of nourishing environment, whether it's a consultation group, your own therapist, a supervisor that's nourishing you, that it's like, well, yeah, where are you going to get it from, and what's that going to mean for the way that you are, the person that you are being with, and with patients, how are they going to experience you? So um, yeah, I think psychoanalytic training does it. I know that you and I were maybe lamenting some of those processes, that they can be quite rigorous and quite difficult, and sometimes this, I'll speak to they can feel a little bit too rigid or formal in their. I know they have purposes, but yeah, that sometimes maybe we lose sight of the bigger picture sometimes with our attention to those details. Yeah.
Well, I think what's so valuable about this conversation today is tension that's always going to be there. Talk about tolerating ambivalence between the implicit, as you said, and explicit, between what's epistemic and what's ontogenic. The idea that they're at odds is, I hope there's not somebody saying they're at odds, because they're not. They're supplementary. They're synergistic. Certainly, they inform one another and they're present in the room at the same time. It's that, like you said, there seems to be, it's expedient or more convenient to teach it in an epistemic fashion than it is to teach it, you're using the word procedural knowledge, in an experiential fashion, or an ontological or one, or ontogenic one. And that just means nature of being, the nature of being the analyst, being the patient, what it's like to be in the room, as as opposed to do, intervene. And how knowledge is transferred, is another avenue we could go down, and sort of the pedagogical components. At the same time, there's this, I think what's very interesting in what you're bringing to the table today is how to negotiate these avenues of information. That to me is something that's maybe a bit quieter in any modality or any field, related field, tangential field, and not something that's, as no pun intended, as explicitly spoken to. Of, well, we have the pillars of training, supervision, therapy, class, control cases, and those seem necessary, certainly. But the pillars, or I use the phrase avenues of information, is very much harder to internalize, let alone integrate, or you'd maybe say embody in the practitioner as well as the patient. And I would say, to maybe bring it back to you, is there's the verbal, right? There's the nonverbal, there's body language, there's silence, there's transference, countertransference, and more. I mean, you could say that those are maybe the most fundamental or basic, but how do you, rhetorically, I'm asking, it's how does anyone negotiate all of that, or pay attention to that, or learn to use their own clinical instrument, their clinical gut, when I've experienced a patient being silent for 45 minutes of a session. I've experienced a patient sleeping through a session. I've experienced a patient screaming their head off through a session, but saying nothing. And if you're not tolerant of I think your word play is helpful, of the playfulness in somebody saying that they want to decapitate you, or fuck your brains out.
Yeah.
You're robbing them of understanding so much. The medium more than the message there. What's behind? What's generative? What's producing it? And that art is what I agree with you. In my experience as of late, especially, is so lost because we're so keen on neutralizing the anxiety or the tension or the discomfort or the hostility or the erotic components and making it safer. But in doing so, just like the parent, we collapse the possibility of understanding what's going on. You know, the man behind it.
Yeah.
I know I said a lot, but
No, I'm sitting with all that you said, and where my mind initially went is in how we navigate, how we, in some ways, I guess we have to navigate the tension of expediency, as you mentioned, of this pressure, again, whether it's from, say, an insurance company, a graduate school, of doing things efficiently. Because I think what we're both kind of emphasizing here is these things take time. It takes time to get to a place where maybe for many of us, to get to a place to be able to bear the feelings, the complicated feelings that may emerge in 45 minutes of silence, that may emerge in 5 minutes of silence.
Sure.
And so how do we instill that where one can hear themselves, hear the patient, navigate that, feel comfortable with feeling uncomfortable, not feel like you have to jump in and fix it, jump in and say something, to be able to bear, abide, absorb those things, to wait. One of my supervisors, I'll name drop Winnicott again, but he's very Winnicott. It's like, and very relational, which I think I'll soapbox on relational and the misnomer of relational. But one of the things I hear him say, wait, that there's this, that you don't have to jump in and do something so quickly. But I think at an implicit level, that sensibility, the curiosity, the humility, bearing the difficulty of waiting, tolerating the anger, how you're getting it wrong, your limitations, your imperfect, we can say them rationally, but it is a difficult thing, as you said, to experience that and to be in the position of helper and to feel maybe that what you're doing is not helpful or, that it's limited. I think maybe to add something here to the idea of play, I almost want to messy it up a bit, like rough and tumble play, or, kind of, I like the word reverence, where it's playful, yes, but we're also talking about very difficult things, and it's messy play, it can get really messy. And how can you stay in the wrestling with that? I think it's really fucking hard. Yeah.
Yeah. And how do you stay in it? Wrestling, play, getting muddy. Mm-hmm. At the same time, maintaining all these things we speak to. The metaphor, it's so funny how limited we are in language when we're speaking today about listening implicitly. And that's not a coincidence, because we can say, be curious. And the anxious, well-intended therapist could be like, well, I am curious. What the fuck does that mean? I'm very curious. I love helping people. Mm-hmm. But the holding, I don't know what a way to put it, mediating or modulating curiosity through an authentic sense of humility, because you've gotten your ass kicked through your own treatment for 10 years, to realize your own foibles, to internalize them without having an ego drive anymore, but being able to be in the room with somebody without any prerequisite desires or secondary gain or narcissistic gain of your own. I mean, talk about taking time. And so the metaphor I use all the time is spinning plates. And the better you get at the work, and the more, in my experience, a patient advances in their own development of becoming themselves, so the striving towards their own satisfaction, making meaning in their own lives, finding fulfillment, the courage to lead the ordinary life. I'm thinking all the things I've read over the years, and the courage to be. There are more plates. So the gym metaphor comes to mind, of course, where you can say they put more weight on the bench press, and at the same time their muscles have grown so they can do it. But I'm thinking of plates, more dinner plates on the old circus, and they're on a 6-foot pole. and now me and this patient have been working together for now 200 hours to make up a number. And now there's 37 plates behind his head or her head and my head. And we're both attuned to them, playing with them. Okay if one falls, okay if another arrives. not
Mm,
intolerant of it, of anything changing.
mhm,
Um, and talk about experiential and holding on to a inherent and unending anxiety, but that anxiety doesn't have to be limiting. That anxiety doesn't have to be contriving. That anxiety doesn't have to be an impingement. It can
mm,
be, isn't that Kirk Schneider speaking about lately, that it can
mhm.
be anxiety could be a life force moving towards development, attuned to enough in service of constructive gain. It doesn't have to be pathogenic, because anxiety is always going to be a part of life, is his point. And so I'm
Sure.
doing a
Yeah.
very disservice if he's going to listen to this. He's going to get very mad. But I'll have him on one day when I'm rich and famous.
There you go.
So it's just fascinating to me. Again, to bring it back, these how many avenues of listening is maybe the through line of this episode, that there really
Yeah.
are. And having to
Yeah.
teach that at the same time, practice it, it is the impossible profession, and also not gratify it. Like you said, what we have to tolerate the frustration, and that we're not going to be satiated, which can really fuck people up.
Yeah. No, I mean, you took the impossible profession right. That came to my mind.
Yeah, I came up with that phrase actually.
Yeah, yeah, yeah. Did you tell my analyst?
Yeah, yeah. No, I told Freud I'm a time traveler. It's a whole thing.
A couple of things came to my mind, but
Please, yes, yes.
yeah, one was I have a colleague that we were on internship together. Was kind of in the existential phenomenological. He had a little Lacanian influence,
Nerds are gonna
and
nerd.
yeah, yeah. And I remember pressing him. I mean, one of the smarter guys I've been around, and pressing him on like, what's the point? Like, how are you assessing for kind of growth? And he kind of looked. He's like, in his way, Frank. He said, I don't know. Is there movement? And that that always stuck with me. And I don't even think I was able to appreciate what he meant when he said that. Then I think I have so much more appreciated now. But that, yeah, is there expansive movement in some type of direction? And there's so much, yeah, so many plates to spin and so many things that can go wrong and that I am not even aware of. And I think yeah, when I speak of reverence and kind of a genuine humility, I think the further you get into this field, certainly the further I've gotten into the psychoanalytic world, the more you know that you don't know, the more that you're maybe hopefully becoming okay with that. But there is, yeah, it's a lot of holding all that you're growing to become aware of and all that you'll never become aware of, and all in kind of both existential things, human things, and what the patient's going to bring in, how they may surprise you, their own complexity. And I think that process, that hopefully, again, supervision, consultation, personal therapy, the classes, they enhance that. Yeah, but it is a humbling, increasingly humbling, I think, profession that can feel increasingly impossible.
It feels. I was just going to say it seems almost exponentially humbling. I would say for where I was year one versus, let's say, to average it out, year 10, it's not that it's logarithmic, the scale. The amount of
Mm-hmm,
humility I
mm-hmm,
experience now, and how that gives rise to so much more playfulness, spontaneity, tolerance for a patient, and also, frankly, efficacy in terms of my clinical gut or skill. It's definitely not linear. And then you could have years, or it's not really years in my experience, but to keep it on the eye, but maybe months of stuckness, and then a movement either through your own treatment or development or something you read, and then similarly with the patient. And so if you can't tolerate that either, is another lesson of a meta
mm-hmm,
lesson of a meta lesson, turtles all the way down. And it's like it's an incredible feeling where your own basic input output system of an ego is not really playing a role. I gotta be a little careful in
mm-hmm,
the sanctuary of the consulting room. By the time you're doing it, in dedication again, and being there for the patient in best approximation as the patient, empathy,
mm-hmm,
quote unquote, and with the patient, and then they doing the same thing with themselves. It's a very different thing being a facilitator and an intermediary, an interrelational component or element to their internal lives, all at the same time, without right having need or desire. Right, I think of what did Anna Freud say, the even hovering attention. Talk about
mm-hmm,
appreciation for that phrase. When I first read it in, like, when I was in college or something, and I was 20, and I was like, oh, that makes sense. Don't yell at somebody. Don't tell them what to do. Versus what it actually means. Holy fucking potatoes. Like, to honor, to dignify all their spinning plates.
mm-hmm,
And I'm a bit of a physics geek as well. And so those metaphors are very helpful in thinking about vectors and thinking about inertia and thinking about drag and thinking about lift.
You're starting to
You
lose
could
me a little bit.
Okay, but I've lost this. There's only 4 listeners left at this point. But the idea that they're just directionality, that there are vectors, starts and ends, and endogenous forces of those vectors. So something's an external force pressing on them. You can feel that. That's very different if it's endogenous or endogenic. I don't know. Depends on how many hydrogen atoms are attached to it. I guess that was another joke for the nerds. But if it's bottom up and internally generated, in other words, and authentic. And you could start to feel that when you, in essence, the patient gets better at the work and you get better at the work. And that's not a form of listening that can really, back to what we're saying, be taught in a book. There's nothing I've ever been, maybe Lacan's the closest in terms of, or Beyond maybe is closer with alpha and beta stuff, but like to see, I think I'm a big neuropsychoanalytic guy now. I like Mark Soames a lot. I've said it in other episodes. I like Turnbull. I like Damasio. I like Chalmers. Like all these people studying consciousness, because all the homeodynamic components of what gives rise to awareness, you know, in global workspace theory especially, are so similarly mapped to how we intervene with play and spontaneity, and saying focus isn't always, our focus is limited. We're not aware of everything all the time. There's stuff going on behind the scenes. And if we can kind of exploit those principles, not only does it help substantiate the stuff scientifically, but also just practically, clinically, it's super neat to have these metaphors help us understand what's going on in the room, as you said, without prescribing anything.
Yeah. And well, I think something that you touched on a bit earlier that I certainly think, you know, still feeling, well, maybe, I don't know if I can still say early career professional, or maybe growing a bit out of that, but
I still feel it. I don't know. Let's say intermediate level now.
I'm respecting the age as we
right.
sporty approaches, but
you do look good for 65. You look very good.
Thank you.
You're welcome.
It's the lotion.
I'll leave that one on the table.
Yeah. But this, me and my other psychoanalytic cohort members, psychoanalysts in training, again, of similar age brackets, but this sense of how time feels different. And maybe only in a way that you can feel different through experience, through getting older, and through a 4-year program sounded different to me 3 years ago. And so, and 5 years of treatment sounded different to me 4 or 5 years ago. 2, 3, 4 time a week treatment sounded different to me before I had went through it and do it. And so there's something there where it's like, it's hard for me to eat, like even once a week treatment now feels like almost the bare minimum that I can do. I'm not saying that people can't benefit from things that are less frequent, but the bare minimum that I want to do, that I find meaningful, again, and I mean that to me, and that I can sustainably do, maybe is a better word. Whereas now 2-3 times a week feels like, to really get into the type of work that I feel like I want to do and that feels beneficial in the ways that I would hope that it could be. I really appreciate the time, intensity, duration more in a different way. 5 years of treatment back in grad school would have felt like that's so much.
A death sentence. When I first started too, it was like, what do you mean I have to go 3 times a week minimum, and I have to lie down on a couch and all this stuff? And then you realize what so much of it, talk about humility. I stand by what I said, that it's logarithmic, even as I review it in real time, where I was so afraid of the couch. I was so afraid of my analyst. I was so afraid of essentially getting to know myself, but I didn't know. So externalizing that onto the process, onto the rigidity, onto the epistemic, rigor of the rule set. And I didn't know, but all of it was to do with my own unresolved and unconscious biases and anxieties and conflicts to do with becoming myself and safely having skin in the game as an analyst and other forms of having a voice. And it is, and back to what we're saying today and speaking to listening implicitly, explicitly, or teaching versus practicing, what have you, being a patient and in the patient experience or the practitioner. How do you show somebody that? Like there's like a hard and fast rule here of, I don't know if it's possible. If I had a time machine, joking aside, and I talked to myself a decade ago and said, this is what it's going to feel like, I still wouldn't, because of the experiential limitation, kind of phenomenological limitation, the
Yeah.
ontological limitation. You couldn't, I want to understand it. I'd say, oh, Max, thanks so much for telling me. You don't look so good. You definitely look older. And then I'd be like, I wonder about my own kids, I guess. And then I struggle with only intellectualizing it, which is kind of the safest bet, where, who says it? It might have been Soames, but somebody else might have said it. Turnbull might have said it. The idealization of cortical thinking being one of the real harms of psychoanalytic training, or of any modality, really, but of being in depth and becoming a psychologist or psychotherapist of whatever variety. And we all intellectualize in the most profound sense, just to say,
Sure.
isolate affect, because it's scary to feel.
Yeah. I think that's well said.
I broke his brain. Ladies and gentlemen, I broke his brain. The first guest.
Here we are. Yeah. I'm the first one.
No, the first guest of Broken Bread. I've had people, but
Man, no, I think, well, I had a thought and I lost it. Hopefully you'll edit this part out.
yeah, sure.
Yeah, that's all. What was I thinking about though? What some of these things, speaking to time, how it experience, I guess maybe I have mixed feelings about my participation in this podcast, just kidding, but about any attempt to convince people
And end session.
about any effort, unconscious or not, to get people to convince them to come into treatment as if they, need it. Because I think what happens at an experiential level is people can get by just fine until they can't anymore. And often that means relationships may start, or lack thereof, may start to break down. The more intimate or the more distant one's relationships get, that you start getting poked and prodded in ways that had kind of been dormant, dissociated, pushed off. And that's when people, they come because something's not working. And it's often in a relationship. And to address that, you have to address it in relationship. And if you're going to address it in relationship, I think what we're both pointing to is that shit's going to take time. That you can't be aware of what you're not aware of, and that there are a lot of complexities to these relational patterns, intricacies, blind spots. And a lot of that takes an intense relationship to even get into what's going wrong outside. And so I guess I don't know if that's a plug in a way, but it just feels true, I guess.
Well, it is back to the avenues of knowledge. It's the idea that, there's knowledge. It's a fun topic, and our colleague Christian, I'm going to have on again to get more, as he's a genuine philosophy professor, and so to speak to all this stuff is so neat that he's also a psychotherapist or psychoanalytic psychotherapist. Knowledge can be derived or generated or cultivated, your metaphor, in different ways, and one of them, like you're describing, is purely phenomenological or experiential, what it is like to be in the relationship with Bob or Sally. And if you're not in the throes of that experience, spontaneity, play, improvisation, again, where it's invited and you're not more conveniently collapsing the frame or contriving something or intervening because the anxieties of, as we spoke to, but you're instead feeling through what that relationship with Bob or Sally is like, by not in the enactment, because you're not gratifying anything or colluding with anything, but holding on to it in that dialectic, in that tension. Again, DBT cannot take that phrase from me. There are other dialectics in life and other dialectics in psychotherapy. And not that I have an axe to grind, and so when I'm holding that space and I'm trying to be that canvas and I'm trying to bottom up elucidate, and then so bring conscious light where it hasn't been before, make space where it hasn't been before, but then also experientially transform. I said this joke to Jeff during our episode, that it's like we all suffer from we were speaking to AI, but we all suffer from a real pathogenic form of alexithymia. We're born with it. And that capacity to convert a feeling into language is a skill. It's really a skill that can be developed in patient and analyst alike, or patient and therapist. And so I need to take that feeling that you're in the relationship as the patient, but you're bringing it here. Maybe we're speaking to transference, maybe not, and or countertransference too. And I have to make it intelligible. And I have to make it intelligible in a way that you can at least internalize it, maybe intellectualize it at first, maybe internalize it later, maybe integrate it after that, maybe bring in, I'm holding the affect for you, so you're experiencing it more neutrally because the affect's too dangerous. Back to the spinning plates. And I'm paying affection and attention to all that at the same fucking time. That's what's so crazy to me. This isn't to say, well, we're the greatest analyst line. It's not what I mean. I just mean that the art and science is such a beautiful dance, poetry, and it's underappreciated, I guess, is my point. And that's what really grinds my gears and motivated me to do this podcast. Is it shouldn't be lost. It's a real skill, and it's something that really heals people. That's the other thing, and it also makes therapists better at their work and less prone to burnout, more keen on finding meaning, more tolerance for all the sort of vicissitudes of life, or the personality structures, and somehow it just feels, sorry to be a cynic, it seems to be getting worse.
Well, I mean, you're making me think of Bromberg's like standing in the spaces.
Mm-hmm. Sure.
Part of me wants to, that feels too distinct. I want to like make it like moving through the mud or something, where it's a bit more gradient. That seems, we were talking about expansion earlier, growth, movement, that in these tension places, in these muddy places, that is, whether it's between art and science, whether it's between self and other, whether it's between different parts of ourselves.
Sure.
That is growth. That is movement, is to be able to.
We'll credit Frank again.
Yes, I'm gonna text him to watch this. Just but yeah, that it's difficult in its muddiness. It's difficult in its uncertainty. But yeah, I think you're rightly pointing to that. That is that's what cultivates good clinicians, and that's what cultivates clinicians that can nourish the being of patients.
It's such a beautiful. There are times that the work is so poignant, so genuinely, comprehensively, wholeheartedly moving in a session, in my experience, keeping it on the eye, that there are no words. It is inherently ineffable by design, not because anyone's failing anything or not because anybody's doing some magical thing, but genuinely because the movement is occurring in a liminal space, subliminal space, maybe, that doesn't need to be rendered, is symbolized in language. And yet, to credit Dr. Frank, it's fucking moving. And in those silences, especially towards the back half or the back 15 minutes of a session, it's profound. And if you were saying that, I've had sessions like this fairly recently with some patients. Obviously, I don't bat 1,000. That's not what I'm saying. I've had those moments, and we both have been stunned by the nature, almost akin to make it more colloquial, make it more accessible, is to say a really good movie, a really good book, and you're stunned. You watch it again, or what is moved? When we say moved, we're speaking to self-state shifting. We're speaking to affect shifting. We're speaking to that. There's this ineffable quality of what is meaning made of when we say, oh my God, that experience of that show, that movie, whatever medium, that book, that conversation was so moving and meaningful. And it's nothing to do with theory, and it's nothing to, I mean, you have some technique of holding that space.
It's beyond words.
Yeah, it's beyond words. But it's so special, I guess, is my point. It's invigorating. And it really, personally and professionally, it really kills me when it's not celebrated and not understood in these multimodal ways, and not talked about with humility, and is lost in academic jargon, or which we're maybe guilty of today, but lost at least in its bifurcations or trifurcations of teaching it as if it's an intellectual pursuit.
Maybe a last thought there of like, it's in the tension here of painful object relationships, painful loss, that therapy is vitalizing too. That there is something here, and that's okay. I don't. Maybe I'm telling myself that, but that even in the humility, even in the not knowing, and even in the reverence, that there are also moments of profound meeting, moments of vitalizing affect that can transform. I don't know that we're not the transform. It's just that there's something that happens.
Right? You can't exactly
beyond us.
Exactly.
Yeah.
You can't take credit for it. And that I don't know if any analysts in the sort of the real heroes in the field would ever say they take credit for it, because inherently, by the nature of doing this work a long enough time, that it's not you. You're facilitating something, certainly. You're providing something, but you're not the one doing the heavy lifting. You're not the one transforming. You're not the one. You can't say, oh, it was this intervention, or it was this particular session, or it was something happening between us in our attunement to one another, and to our attunement to what was going on with all the spinning plates, that facilitated is the best word I get. Maybe there's a better word. The process.
Facilitated works.
It works. Nourished,
Yeah,
facilitated,
cultivated something.
breastfed. Should we go that deep? All right, on that note, I know you have to run. I have to run as well. It was such a pleasure, Dr. Long. Thank you so much. Thank you. It means a lot. I can't wait to have you back again to have these conversations. Are so fun to me. We'll try to maybe get a little more focused. We went everywhere on the next episode, but thank you again. It was a wonderful time.